Hi, I'm Dr. Dan Shapiro. I'm a plastic surgeon certified by the American Board of Plastic Surgery. I've been practicing in the Scottsdale Paris-Orlando area since 1992, and that's all I do. I just perform cosmetic or aesthetic plastic surgery. I do a lot of tummy tucks, and a very common question, because it's difficult for some patients to understand, is, Dr. Shapiro, what do you do with the belly button during a tummy tuck, and how is a new one created? And the answer to the question is depends upon what kind of tummy tuck that I do. In a mini tummy tuck, where I don't really do any operation above the belly button other than liposuction. So what a mini tummy tuck is I make a abbreviated incision that's not that long. I perform some liposuction over the whole abdomen. I elevate up to the belly button, and then I sew the muscles tight below the belly button and then remove some extra skin. In that case, I won't do anything to the belly button, so the belly button stays where it is, and I'm just removing excess tissue below the belly button down to the hairline. Is another kind of tummy tuck where I really don't create a new belly button, but I just move it down. And that is somebody who may have a very, very long waist with excess skin, mostly below the belly button. They may have some excess skin above the belly button, but they have weakness of the abdominal wall, which means that they're puffy above and below the abdominal wall. In that full tummy tuck, what I actually do is I do the full tummy tuck. That is that I elevate the skin of the abdominal wall. I do some liposuction. I sew the muscles above and below the belly button. And then actually what I do is I move the belly button as it stays in the skin, move it down like a curtain, if you will, and then sew it back to the abdominal wall. So what I'm actually doing is moving all the tissue down. I'm leaving your belly button as it exists, and just having it a bit lower on your abdomen. In those patients that are long-waisted, that is a beautiful way to do the procedure. It looks fantastic, and I can do a long abdomen that way and do a full tummy tuck, and oftentimes through a much smaller incision. I'll sew the muscles all the way up to the xiphoid, all the way up to the top of the abdomen and all the way down. In probably about 75% of the patients, what I need to do is a full tummy tuck where I move the belly button. And what that means is that I take your belly button, I cut around it when I do the tummy tuck, I remove the excess skin, and then what I do is make a hole in the new skin that has been pulled down, and pull your belly button through and sew it back in. Now, the whole art of making belly buttons is how to make that new belly button look pretty. And there are many papers that are written on this, but it's very technique dependent. So as a plastic surgeon, you really have to care about it. You have to be passionate about it. And I'm a belly button freak. So what I do is I try to give you something that looks beautiful. It looks elliptical. It has shadows just like you would see in a magazine, and it should look very, very pretty. So a lot of times people end up with a belly button that looks better than when you started. And I'm very proud of my belly button. So there are really a lot of different ways that I approach a belly button. The long story short is I want it to look fantastic. I think that most people realize, and studies have shown, that that's really the first thing that you look at when you're looking at somebody's abdominal picture, whether it be in a magazine or a photograph. You're looking at the belly button. So we want it to look elliptical. We don't want it to look too large. We want it to look sexy. We want the abdominoplasty to look contoured, make the waist look smaller. So abdominoplasties and body contouring surgery is really an art. The best way to find out if you're a candidate, come in for consultation. We'll go over some photographs of what you're looking for. I'll tell you what you're capable of. Go to my website, look at my before and afters, and we'll go from there. Thank you very much.